the last 24 hours, we have identified about 4,752 new cases of COVID-19 and completed about 12,000 tests. Our positivity rate for lab-confirmed cases is 36.9%. Both of these numbers bring us to new record daily highs, underlining the impact of this wave. There are currently 470 people with COVID-19 in hospital, including 72 in the ICU. Sadly, I must announce that 11 new deaths have been reported to Alberta Health over the last 24 hours. There are no perfect, completely risk-free solutions available to us or any jurisdiction around the world, and I believe the provincial approach balances the many competing risks that our children face. The use of rapid testing and medical masks, in addition to the measures already in place, will help to protect students and staff as they return to the classroom. Given the current situation, I also want to note that I strongly recommend that students in all grades wear masks, including kindergarten to grade 3. To keep the risk in schools low, it will be critical for all of us to stay home and keep our children home if any of us have symptoms.
And I'm so pleased to confirm that ECS and kindergarten to grade 12 students will return to classrooms on January 10th. Children who learn in person belong in the classroom, and they will be there with the added safety of rapid tests and medical grade masks. These will be distributed to schools as an added layer of protection to lower the risk of transmission of the Omicron variant. The government will begin distributing shipments of rapid tests and masks later this week, and all schools will have their initial shipments by the end of next week. Distribution to students and staff will occur as individual schools receive their supplies, and both rapid tests and masks will be shipped in phases. This is on top of the many significant health measures schools already have in place, such as vaccine policies for staff, masking, distancing, and enhanced cleaning measures. Obviously, we will continue to, as Dr. Hinshaw said, that if there are people with symptoms, whether it's a student or a teacher or a staff member, they should stay home and take a rapid test, and if that turns out to be positive, they should report it to the school. We will then look at, the school authorities themselves will track absenteeism. From a general perspective, we are looking to refine the actual numbers that school authorities would be looking at. If there's high absenteeism, whether it's students or staff, as well as spread within the community, et cetera, all of those factors would be taken into account. From a school authority perspective, they would look at, do we need to shift, or do they need to shift a classroom or a grade to online learning if it's required because of high absenteeism and other health indicators within their schools. If not, they would continue on, provide the subs, et cetera. If, in fact, there are larger numbers, then we would look to them to approve those shifts. And if there are even larger numbers affecting a school or a whole school authority, then they would approach my department and we would have the conversations on if there's a shift required for a larger group of individuals.